Where's the pterygoid, bro?
The pterygoid is going to be located deeper into the cranium. It's actually part of the sphenoid bone. It's part of the sphenoid bone. There's going to be some wings some muscles are actually attached there. Some of the muscles are going to be responsible for opening and closing our jaw. Now, the beauty of that bone is that it's very thick, it's very dense, and it's always going to be there.
Always.
So,
what do you do when somebody comes in and says, you know what, Dr. Elias, I want to get all on 4, all on 6, but their sinuses are just extremely low?
Just because you can't do it doesn't mean it's not possible.
That's exactly where I'm getting at. You know, if something is out of our hands, we're going to say, you know what, we can't do it. Hello, welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. Remember, we have a phone number. We have an email. You can go ahead and send us messages. Leave us messages of anything you would want us to speak about in future podcasts. Remember, this podcast was meant for you, our patients. But today we have Dr. Elias with us. How you doing?
I'm doing great, Frank. How about you?
Not too bad, not too bad. Well, I wanted to talk about different things. You know, we've been seeing a lot of cases lately. We've been seeing them for a very long time, but more lately, more than so, that a lot of our patients come in and they have very complex their situations are very complex. They want to get implants. They want to be able to have a smile again. They want to be able to eat the things that they want to eat. I'm talking to a lady right now, and she has something going on, a medical condition that she needs to be able to eat her food and chew her food right.
Right.
And she can't with the dentures that she has. But then again, she doesn't have much bone. So, you know, talk to me about what happens if you're trying to get something that is permanent, and what happens if their sinuses are extremely low. Like, what can we do? What have you encountered?
As you mentioned, lately we've had that situation go on more frequently. One of the reasons might be that the patients are waiting more time.
Correct.
Without teeth, and we have more bone loss, right? Why? Because the bone is going to function the way a muscle functions, right? When people go to the gym, this is how I explain it to my patients. When people go to the gym, they work out, their muscle grows, and it stays a certain way, right? But if you stop going to the gym, you lose the muscle because it's not being used. So no nutrition is being sent there. The bone works the same way. When we have teeth, the roots of our teeth, every time we bite, certain pressure is being applied to the bone, and it maintains the bone that way. Nutrition is being sent there. Once we extract the teeth and we don't place anything, grafts or anything, the bone starts going away because no pressure is being applied directly to it. Not even with dentures, because dentures only goes on top of the gums.
On the surface, correct.
Yeah, so we lose a lot of bone.
So, what, you know, I explained it. Well, I used to explain a little bit different. I used to say, for example, you got a tree, right? And there's dirt around it. You got a dirt hill around the tree, but then you take the tree out. You know, after a while, that piece of dirt is going to start going away because of the wind or whatever it is. There's nothing there to hold the dirt there anymore.
Right.
That's pretty much the same thing when you have teeth, and then you extract those teeth, and then we start having all that bone loss.
Right.
So what do you do when somebody comes in and says, you know what, Dr. Elias, I want to get all on 4, all on 6, but their sinuses are just extremely low. Are sinus lifts something that you would want to do? What do you go about?
It depends on how low the sinuses are at. But on atrophic maxilla, when there's not a lot of bone, especially on the upper jaw, right?
Yeah.
We start looking in other directions. Another bone that's always going to be there, with teeth or without teeth.
Not in the sinus.
Not in the sinus. In theory, with the all-on-4 treatment or the all-on-6, we try to avoid the sinus as much as possible, right? That's why the all-on-4 was created, because in theory, the back implants are going to be angling. They're going to be angled to avoid the sinus, and we can correct those angulations with the multi-unit abutments, right? So in those type of situations, what we do is we try to place the distal implants angled towards the front. But sometimes still there's not enough bone there, right? Because at the end of the day, we want to distribute the implants on certain positions where they're going to hold the biting force, right?
For stability.
For stability, that is correct. And sometimes we have to look for extra maxillary bone that's always going to be there, but it's not located in the jaw per se. Sometimes we have to go up into the nose. Sometimes we have to go up into the pterygoid region or the zygomas.
What do you mean by up into the bone exactly?
Up into the nose. Sometimes when there's a lot of bone loss, we have to anchor our implants into stronger bone. We classify bone on depending on the depth, the quality of the bone, how strong it is. Usually the maxilla, the bone is very, very soft. So we try to reach other regions where the bone is a lot stronger, like cortical bone.
You're talking about bone right here?
Bone, yeah, around the floor of the nose, around the sides of the nose.
That's why they're called nasal floor lifts.
Yeah, that's why sometimes we everything is done through the mouth.
Nothing on the outside.
Nothing on the outside. Yeah, everything's on the inside, but we can access the holes of the nose, separate the tissue that's there, the membrane, lift up the floor of the nose so we can actually see the bone and place our implants through there without injuring other regions of the nose.
Welcome to Dental Facts. Did you know that the cotton machine was co-invented by a dentist? You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
So you already told us about the nose, the nasal floor lifts, but you also mentioned the pterygoid and the zygoma bone.
Right.
Where's the pterygoid bone at?
The pterygoid is going to be located deeper into the cranium. It's actually part of the sphenoid bone. It's part of the sphenoid bone. There's going to be some wings some muscles are actually attached there. Some of the muscles that are going to be responsible for opening and closing our jaw. Now, the beauty of that bone is that it's very thick, it's very dense, and it's always going to be there.
Always.
Always. Always. There's even a study out there that people without teeth tend to have bigger pterygoids.
Really?
Yeah.
So that pterygoid, where exactly is it in your face?
It's actually inside the cranium.
Okay.
So it's all inside through the mouth, all the way in the back, where the wisdom teeth used to be. That's where we're going to access that part of that bone.
And that's on your upper, not on your lower?
That's upper.
Only your upper.
Upper, that is right.
And so you're telling me if I use a pterygoid implant, I don't have to go to my sinus?
That is correct. We're going to avoid the sinuses. Yeah.
So if someone comes in and so you come in, your sinuses are shot, they're bad, you have infections in your sinus, or they're just extremely, or you had infection in the past and they're just extremely low, you can still get pterygoid implants, and you could still get nasal floor lifts, and you could still get a permanent.
That is correct. Even an immediate load.
Wow.
For sure. Sometimes when the sinus is very, very low, what we can actually do and what we've done in the past, we lift the sinus up and we pass the implant through the back, but all the way to the nose, engaging the nose where the bone is better, right? So that way we can actually get the torque that we've been talking about, and we add the torque from the nasal floor, from the pterygoids and the interior bone, and we get great torque, and we can actually immediately load.
So let's go back to that torque again. You said, right. So let's say I come in and my sinuses are good, and I can get an all-on-4.
Right.
How much torque? How much that's torque? You're talking about the strength of the implant. Right. How much torque can you get, or do you need to get to sustain an all-on-4?
The minimum is 120 torque value between all the implants.
Okay.
Right, that's the minimum that we should get.
So you're looking at about 30 per tooth.
Yeah, pretty much per implant. Yeah. If it's 4, yeah, we're thinking about 30, 40. Me myself personally, I like to play it safe. I don't like the 120. I think that's
very close.
Very close. I'd rather go 150, 180, even 200. The beauty of this is that with the pterygoid implants, we've gotten all the way up to 80 newtons
per tooth.
Per implant, per pterygoid. So with just 2 pterygoids,
that's 160.
Yeah. So that pretty much secures my immediate load.
So with 2 pterygoids, you're getting more than what the least you should get for 4 implants.
Right.
With 2 pterygoids, you're getting 40 more torque or 60 more torque. Well, right. You said 80 and 80, 40 more torque.
Yeah.
Wow.
And it also eliminates the back cantilever of our prosthesis. because sometimes the sinuses are very clogged up, that the implants in the front are pushed too much towards the front, and we have to do small arches with less teeth.
And by a cantilever, you mean?
The cantilever is when one of the implants is in the back and there's still a part of the prosthesis to the back where we apply pressure and there's nothing holding back.
So there's no pillar. So
no pillar in the back.
Normally you got
correct.
pillar, and you got the missing teeth here. This one is pillar, and it keeps on going back without being another pillar back there.
And it applies a lot of pressure towards the prosthesis, and we can have loose implants, loose multi-unit abutments.
It's like...
Yeah. So with the pterygoid implants, the Dr. Dan Holtzclaw it's been out in practice since 1970s, but the thing about this implant is that you have to know the anatomy really, really good, right? Because there's some anatomical structures that are vital. So it was rarely used, but Dr. Dan Holtzclaw has made this implant popular again with its benefits and with his techniques and with his book, and it's been a real game changer for us.
You said Dan Holtzclaw?
That is correct.
Now, quick question on the cantilever. Is that like the Maryland Bridge?
The cantilever, well, it's sort of like the Maryland Bridge would be a missing tooth, right? But the cantilever is like when you don't have a pillar in the back.
Okay.
Where everything is being sustained with one in the front, and even pressure is being applied.
Okay. So it kind of works as a leverage and it starts hurting.
Yeah, I actually didn't know the word leverage. Yeah.
Okay.
La palanca, the leverage.
So Dan Holtzclaw, you said, right?
Dan Holtzclaw. Yeah.
Is that the book that you carry around everywhere here at the
Yeah.
When I tell you to put the coloring book away.
Yeah.
Everywhere he goes, he carries his book. And he said, I think, is it one or two books that you have from him?
2 books.
Okay.
Yeah.
Yeah, because he carries around those books and he's reading them like all the time.
Yeah.
And actually, you just came back from a couple weeks ago. You just came back from Spain, Canary Island.
Yeah.
And you actually got to meet him?
Yeah. Yeah, I got to meet him.
What was that like? So you got to meet the guy that you're reading his book.
Yeah.
That doesn't happen much.
Yeah, it was pretty crazy. It was pretty crazy. Even when you mentioned that I was going to get to go to that course.
Yeah.
Right? I was reading the speakers and I was like, hey, I know that guy. You know?
Wait, I remember you sent me a picture of his book.
Yeah.
You're like, I'm reading this right now.
Yeah.
So it's like reading a superhero book and there's a superhero. So I'm gonna keep on reading Batman and maybe I get to meet him.
Yeah, and I got to meet him. I got to meet him and his right hand man, which they work together, Dr. Juan Gonzalez. Pretty cool guy as well.
So you told me when you got to meet him, you actually got to ask him a lot of the things that you have read.
Right.
I bet you that, if I read in a book and someone comes up to me and says, "Hey Frank, I read your book and I got some questions on the things that you actually wrote about." That's a big honor. I mean, obviously he has a lot of people that go up to him all the time, perhaps not, because it could be pretty intimidating.
Yeah.
But what was it like to actually, how long did you guys just tell him, "Hey, how you doing? I'm a big fan," or how did it work?
Well, we saw him, right? He just finished his lecture, his part of the lecture, and he was there. He was a pretty cool guy, man. He was talking to everybody, shaking hands.
Good.
Yeah, he was pretty cool. So me and another doctor that's actually from here, Los Algodones, we saw him. We're like, hey, let's go chat with the guy, And he was pretty cool. We talked about his book. We had a few questions about the technique, which he actually modified from that version of the book, and he gave us little tips on how to do it. Some of his enclosed techniques, and it was pretty cool. So
see that's what I love. It's you got some great dentists. You have some old school dentists that they don't change much of what the research is or whatever it is. And then you got these, to me, they're hybrid dentists. These dentists that do numerous things, or they're not afraid to say, you know what, I found a better way to do this. Like I found a better way, or maybe if we tweak this a little bit, tweak that a little bit, then it works out even better.
Right.
Because at the end, it's we're not working on our mouths, we're working on our patient's mouth. So whatever's better for them, whatever new technology comes out, whatever new techniques come out, obviously we want to do what's best.
Right.
So back to the pterygoid implants. So you got to meet the guy that you're reading the books from, Dan Holtzclaw. And am I saying it wrong?
Yeah.
Dan? Okay. And big shout out to him if he ever watches this. and so you're doing all this and you start doing these pterygoid implants.
Right.
Now, why isn't there a lot of dentists that perform this? Because right here in Los Algodones, we have, I think, 117 clinics. Who knows? Maybe they got more right now. I don't know. There's over, I think in Guinness World Record, they said over 700 dentists. I'm not sure. why is there only like 3, 4, 5 doctors that do it here? Like, what's so hard? Because right now everybody and their grandparents do implants.
Right.
Like, it's at some point it was so hard to get an implantologist, and now everybody is an implantologist or studying to be an implantologist. Why is it so hard to do pterygoids?
I think the complexity of this implant is the region where it's placed. In order to do this implant, you need to have a lot of experience doing full arch implant dentistry. And I'm very fortunate to be here at Supreme, where I actually get to do
Thank you.
2 or 3 a week, upper and lower, and I've gotten a lot of experience I felt that have gotten way better. You know, I personally love surgery, and I think I've gotten a lot better. I get a lot of experience, and it's the technique. It's actually more of a feel technique than you are actually seeing it. So you have to visualize the CT scan, everything, and you have to feel, and you have to have a lot of experience. You're not actually seeing where you're drilling. That's where it becomes complicated. Because you're just drilling, or you're just hitting the osteotomes, right? So it's a lot of, and the implants are longer. Usually you place implants from 10 millimeters, the longest one is 16 millimeters, and on pterygoids, the minimum is an 18, and you go all the way up to 25, right? And if you don't know your anatomy, if you don't know your angles, if you don't know where you're going, usually with the other implants, if you mess up, you send it to the sinus, well, you just get it out of the sinus, right? Or if you drill out, well, you just pull it out, and that is that. With this implant, if you don't know what you're doing, it falls into a region where you can't really get it out.
You can really hurt somebody.
You can really hurt somebody, yeah.
But doing it right, obviously, with much power comes great responsibility,
right,
or something like that. If you can do it, you could actually give someone their smile back.
Correct.
You know, there's a lot of clinics out there that you walk into their clinic, they take a look at you, and your sinuses are bad. And they don't perform nasal floor lifts. They want to do bone regeneration. They want to do numerous sinus lifts that sometimes is like, we'll do one sinus, we'll do a second sinus, we'll throw some holy water, and we'll step on one leg, and hopefully we're able to do an implant. If not, we'll have to do another sinus. And with this, you avoid those problems.
Right.
So it's less money spent from the patient, less invasive to the patient.
Time
Consuming, and a lot better results, because no matter how many times you do a sinus lift, you can only get so much torque on that bone that it will never compare
to the natural bone, yeah,
and to the pterygoid bone.
Yeah.
So that is, so like I said, there's a lot of patients that come in and say, those clinics turn them around. Say, you know what? We can't do anything. You can never get a full mouth again. You can never get something that's permanent. And that is wrong.
Right.
Here for many years we couldn't do pterygoid implants. Actually, Dr. Elias performs pterygoid implants. We're really proud of him to be here.
Thank you.
And it's a process, and we're working on for others to jump aboard, and we're looking on Dr. Elias to really keep on pushing forward, because even though if you know how to do it, and he's done numerous already. Like I said, we had a patient, and in one of our last podcasts we said we had a patient that it was in his 70s. You said in his 78, 75?
Yeah.
And he hadn't had teeth for how long in his upper?
About 20 years.
20 years. So normally, 20 years, no teeth on the upper, the sinuses are going to be shot. That's what we're thinking already, right?
Right.
And then he's 70s, late 70s. It's not going to work out. Normally, years ago, automatically would have been like, we're going to do a CAT scan, but you can get snap-ins.
Right.
And that's about as good as it's going to get. And now it's like, you did pterygoid implants, you did did you do nasal floor lifts, or did you do?
Yeah, we did the traditional all-on-4. We did a little bit of a nasal floor lift to anchor better bone and the pterygoids.
And he was able to walk in with an immediate load, walk out.
Yeah.
So for the first time in over 20 years, he had something permanent on his upper.
Yeah. Looking
forward for his final work 6 months, 8 months later.
Right.
What is that? How does that feel? Obviously, there's dentists, like I said, there's dentists that become dentists, and to me, there's dentists that are born dentists, and to me, we have a lot of dentists here that are born dentists, and you're one of them.
Thank you.
So you look at this, and you're just like, this is me reading these books, because obviously you became a dentist, then you became an implantologist, And now you're moving forward to new things to be able to help our patients out that are turned away from other clinics that say, oh, you know what? We can't do it. Shut the door.
Right.
We can't do it. Shut the door. And because they can't do it, they're not like, well, there's a way to do it, but we can't do it.
Right.
They just shut the door, and the patients come in feeling like this, and then the patients walk out feeling like this.
And they come from very far away.
Far away. They invested to get here. And not just that, is their self-esteem.
Right.
Like, they're just like, well, I went all the way to Mexico. They told me they can't fix me. I can't afford the way that they want to fix me here. It's probably going to be the same thing, but a lot more expensive. And they're just devastated.
And we've gotten a lot of those, that have been turned back by other clinics. Like, no, you cannot have implants. And even Holtzclaw talks about this in his book. Like, just because you can't do it doesn't mean it's not possible.
That's exactly where I'm getting at. If something is out of our hands, we're going to say, you know what, we can't do it. Actually, not too long ago, somebody came in and said, we can't do it. You need zygomatic implants.
Right.
And you need to go somewhere where they do zygomatic implants. You need to do your research, but we don't just tell them it can't be done.
Right.
Like, I think there's a lot of professionalism when it comes to, I can't do it, but there's somebody else that can. Keep on exploring. Go ask those questions. Go look for those doctors. Well, congratulations. I mean,
Thank you.
That's I'm really looking forward to different things. Looking forward to different trainings. I'm super excited. I know there's things that we're working on right now that you know about.
Yeah.
That later on it will come out that I'm super excited. When we have them here, we'll talk about them. And I feel that our goal is in the future to change the way that dentistry is seen in Mexico, because there is great dentists here, and there is great technology, and there's people that really are looking out for people. And that is, I feel like there's dentists like that all throughout the world, but they're also here.
Right.
So that's one thing that I want the world to know. But thank you so much for your time today.
And I want to thank you guys because this is really honest. He's
gonna make me cry.
Especially Frank, with me and with everybody else, he's always pushing us to do better. Even if we're a little nervous about something, you're always, you could do it, so, and that's very important when you get the backup from your boss. Yeah, that's all we need now. That's all we need.
And the thing is that you guys push us, because you guys come in with this new technology. Hey, I heard about this. Hey, I want to go to this training. Right. And I'm just like, where? Spain? What? Go. 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 We're gonna go next year, as you know. We're going to go to Singapore, and that is to like the World Cup, the Olympics of Straumann. Right. We're very proud of that, and we'll talk about that in a different podcast. So we are going to different parts of the world. It's like that song with DJ Kelly, like, hopefully he doesn't sue us for this, but we're taking over.
We're taking over
one city at a time.
Yes, sir.
So that's what we want to continue to do. And like I said, thank you so much for being here.
Thank you, Frank.
We got to go, the times of the essence. We got George over here telling us to go ahead and cut already. Yeah. He wants to go home. He wants to go party.
Watch a soccer game.
Watch a soccer game from his team that never wins. And I want to take, once again, George. George from Torreon, that he does great videos. He's part of this podcast. We also have Carlos Ayala, who was able to get this podcast. I haven't thanked him yet, but he was able to get everything going. I tell him, I don't like this color. He changes the color. I don't like this. My wife came in and she said, I don't like the way this looks. He had to change it. He's part of the crew also, but you guys don't see them because they're behind cameras. But we want to thank you guys so much. And thank you so much for listening and being here with us. Like I said, don't forget to like and subscribe. We will be talking more about pterygoids, zygomatics, and about a lot of little gifts we got later on, little secrets we got that I think definitely is going to change the industry here where we're at. Alrighty? Thank you so much. Have a good one. Thank you.